The main factor contributing to disability worldwide is depression. Nearly 10 of adults in the United States experience depression. However, since it is a mental ailment, it might be far more difficult to comprehend than high cholesterol. The distinction between experiencing depression and simply feeling depressed is one of the biggest sources of confusion. Almost everyone experiences depression occasionally. Sadness can be induced by a variety of events, including receiving a poor grade, quitting your job, getting into a fight, and even a cloudy day. Sometimes there is absolutely no trigger. It just appears out of nowhere. Then, as circumstances alter, those depressing emotions vanish. Different is clinical depression. It's a medical condition, so trying to make it go away won't make it go away. It lasts for at least 2 weeks straight and seriously impairs one's capacity for either work, play, or romantic relationships. A wide range of symptoms can be associated with depression. A depressed mood, losing interest in activities you'd usually enjoy, changes in appetite, feeling overly guilty or unworthy, sleeping excessively or insufficiently, having trouble concentrating, being slow or restless, losing energy or having suicidal thoughts repeatedly. Psychiatric standards state that you can be diagnosed with depression if you exhibit at least 5 of the symptoms, and the symptoms go beyond behavioral ones. Inside the brain, depression manifests as physical symptoms. First, there are alterations that are visible to the unaided eye and with X-ray vision. Hippocampal volumes and smaller frontal lobes are a couple of these. More specifically, a few factors are linked to depression. Aberrant neurotransmitter transmission or depletion, particularly of serotonin, norepinephrine, and dopamine, impaired circadian rhythms, or particular alterations in the REM and slow-wave phases of your sleep cycle, and hormonal disorders including excessive cortisol and thyroid hormone dysregulation. But the exact reasons of depression remain a mystery to neuroscientists. We lack a diagnostic tool that can precisely forecast where or when it will manifest itself, despite the fact that it appears to be related to a complicated interaction between genes and environment. It can be difficult to tell who appears to be in good health, but is actually battling with depression because its signs are invisible. The average person with a mental illness waits over 10 years before seeking assistance, according to the National Institute of Mental Health. But there are remedies that work incredibly well. In order to increase brain chemical levels, medication and treatment work best together. Electroconvulsive therapy, which simulates a controlled seizure in the patient's brain, can be extremely beneficial in extreme circumstances. Investigations are also being conducted on additional possible treatments, such as transcranial magnetic stimulation. Therefore, if you know someone who is experiencing depression, kindly suggest that they look into some of these possibilities. You might even volunteer to assist with specific chores, such as compiling a list of questions to ask a doctor or seeking out local therapists. These initial measures could appear impossible to someone who is depressed. If they experience guilt or shame, remind them that, like diabetes or asthma, depression is a medical disease. It's neither a flaw nor a quality of personality. Neither should they assume that they can just overcome it any more than they could force themselves to recover from a broken limb. Avoid comparing depression to other times you felt depressed if you haven't really experienced it. They may feel guilty for struggling if they contrast what they're going through with typical transient emotions of grief. Even simply discussing depression in public can be beneficial. For instance, research demonstrates that inquiring about suicidal thoughts really lowers the suicidal risk of the subject. Open discussions about mental illness aid in reducing stigma and make it simpler for people to seek assistance. Additionally, as more individuals seek treatment, researchers will learn more about depression and develop more effective treatments.